I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. We have a quorum present. Supervisor Zhang is running a few minutes late. We will go on to public comment, and I have had 3 individuals contact me. We'll start with Brady Cannonberg, if you'd like to come. Oh, we're getting set. Who'd like to go first? Mark, do you want to? Dave Brula. Okay. For the record, Board Vice Chair Boots is also on the call, or is on the WebEx. Go ahead. Here. If you want to just come.
All right, now I'm really directing my comments right to you.
This is internet.
Yeah. Dave Brula, 167949 Luschwager Drive, Ringgold, Wisconsin. And I am here representing Village of Rothschild in relation to agenda item 6B6 as it affects a tattoo convention that I'm working on. My role at the Village of Rothschild is Tourism Marketing Director. Part of that role is supporting groups or events in the Village of Rothschild and the greater Wausau area, as well as booking events and helping them in any way I can to retain the business in this area. This particular event I've been with since the beginning. It's something that I actively pursued, working with a local shop that I know is reputable, and then doing a lot of homework. As we wanted a tattoo convention, we wanted one that was well run and clean and good, and had a history. And this is over 30 years operating, and I've seen their work, so I'm very excited to have them here. I am going to just speak to the economic impact of the event, and this would be using Travel Wisconsin's calculation methodology, as well as Longwoods International and Tourism Economics, which Travel Wisconsin, the Wisconsin Department of Tourism, uses for everything that they do as far as economic impact studies. And this event is expecting 6,000 people total attendance. I always base everything I do off of half of what the group is expecting, just in case. So basing it on an attendance of 3,000 people, we would be looking at somewhere in the area of 500 hotel room nights, and a total of 1,000 overnight visitors as the groups. Some of them will have more, some will have less. And then day visitors about 1,250, local attendees about 750 make up that 3,000 person attendance. The direct visitor spending would be $312,750. And then with additional activity, the way that Travel Wisconsin does their calculating, there's basically the initial impact and then the impact of after spending, the employment, stuff like that. So that additional activity, that multiplier that they would call it, is $184,523, with a total economic impact expected of $497,273 for our area. And then I broke that down also into total estimated tax revenue for the Village of Rothschild, which would approximately be $4,000, including that hotel motel tax. And then the total estimated tax revenue for the county from this event would be $1,500. And I just thought it was important to make sure that the understanding of the economic impact of this event, as we're going over the pricing and everything for how much it would cost them to hold this event in Marathon County, to give it a little bit of a bigger full-scale picture. I appreciate your time and your consideration. Thank you.
Thank you. Next we'll call on, I don't know, Dave or Mark or Brandy, if you want to.
All right, good afternoon. My name is Mark Cannenberg. I own Marked Up Tattoos here in Marathon County, and I hold one of the 32 permanent body art establishment license this proposal affects. I want to be clear, I'm not here to oppose right sizing the fee structure. I understand the reasoning behind the practitioner-based approach, particularly for large temporary events like the one I've been helping plan. My concern is about timing and permanent establishments, and it's really a question about the department's own stated principles of simplicity, consistency, and fairness. I'd like to ask, is it fair that the license holders who renewed in the spring pay $320 while the same license renewed in the fall would pay $220, purely based on when the proposal happens to be approved? Is it consistent to update annual fees mid-year outside the normal budget process, especially when today's own agenda shows 2027 budget discussions are already underway? Given that, I'd respectfully ask the county to consider the timing of the permanent establishment change separately from the immediate temporary event issue, and to have any change affecting permanent establishments take effect at each business's next renewal, consistent with how annual fees are normally updated. Thank you for your time.
Thank you. Randy, did you wish?
About this?
Should be on.
Okay.
It's green, it's on.
Good afternoon. My name is Brandy Cannenberg. I've been assisting the organizers of the Cedar Creek Ink Fest with the licensing and fee structures of the Tattoo Convention. It is a 3-day event scheduled in Rothschild, October 16th through the 18th. Under the department's current interpretation of the existing fee structure, which is approximately 46 to 60 separate establishment licenses would be required. That is an estimated total of cost of $9,568 to $18,480. We researched how Wisconsin jurisdictions license similar events, and we shared that research with the department, which reconsidered its approach. We want to be clear that the resulting cost is still a significant expense, several $1,000s for a 3-day event. Our position is that a single event level license may be the legally correct outcome under the existing statute. Sauk County has already licensed the same organizers convention as a single establishment. We had an event in the Wisconsin Dells. We want the record to reflect that we consider this unresolved. Our priority now is having a clear and confirmed licensing structure in place with sufficient time for the organizer and participating artists to prepare for the October event. Thank you for your time.
Thank you. Is there an objection for us taking up that item 6B6, recommendation to modify an existing health department fee schedule regarding tattoo and piercing licensure out of order, and take it up at this time? Any objection? If not, we will, before we do that, I'd like to just deal with the approval of the minutes of the July 28th meeting. They've been part of the packet. What are your wishes? Chair Gibbs moves to approve, seconded by Supervisor Watson. Any discussion? Not all those in favor of approval of the minutes will signify by saying aye. Aye. Opposed, no. That motion carries. And then again, without objection, we'll jump to item 6B6, recommendation to modify an existing health department fee schedule regarding tattoo and piercing licenses. Administrator Leonard.
Thank you, Mr. Chair. Appreciate taking this out of order. We have Kate Florick here from the Health Department to kind of give you the background, but there is a memo in your packet. It begins, because this was at the end of your agenda, on page 213. But I think the public comment did a good job of kind of laying out what the issue is. Under the current interpretation under the DSPS licensing, which again, just for background, the health department does licensing on behalf of the state of Wisconsin for establishment licensing for body art. Individual practitioners are required to hold license, and keep me honest, Kate, they're required to hold licenses through the state of Wisconsin. But when we talk about establishment licenses, those are things we do here locally. And we have that within our existing fee structure, which is approved annually through the budget. And it's on page 162 of your budget, where we talk about not only permanent establishments, but also, as was alluded to in public comment, temporary licensure for establishments for tattoo and piercing work. Now, the issue is within that interpretation, and Corp Counsel Desmond can elaborate, but essentially when you're talking about establishment licenses, DSPS, the administrative code, has a definition that it has some room for interpretation, whether that's it can be a single building, or it can be an area within a building, which I think, again, lays the context for what we're talking about here today. So the proposal that is in your packet is to further clarify in terms of how we apply that license to have a definition of establishment that really is tied to the number of practitioners that will be operating. So if you're a permanent tattoo establishment and you have one employee, one individual who performs that work, you would have a single establishment license. Similarly, if you had 2, 3, 4, or 5 normal practitioners or 6 in that single space, you'd pay that single tiered, the lower tier of that establishment license. The issue is when you have larger permanent establishments, or in the instance of temporary licenses for events like were alluded to in public comment, breaking up and having that tiered structure for an establishment. And we do have temporary licenses that Kate and her team do issue temporary licenses for events, and Kate can elaborate, but there's a Harley event where 2 independent tattoo places would perform one. They would get a single temporary license. What we're talking about is having that tiered structure apply to larger events. So we don't have an occasion where if there are going to be 100 separate tattoo entities, I used Lance's Tattoo, which doesn't exist, at Health and Human Services as the example. If I was going to go to that event, rather than saying Lance's Tattoo needs an individual temporary license, as does every practitioner, setting up a tiered structure to alleviate what I think everyone would agree would perhaps be some inequity and certainly some complexity with that fee structure. So that is the proposal that is laid out in the memo. That's the overview of it. It doesn't fundamentally have a significant impact on the budget. Again, the proposal is to have, and I think certainly open for debate, the effective date of this, rather than have an event with 100 practitioners where because we do have to inspect all of the locations, which Kate can talk through, rather than requiring 100 temporary licenses to do it in a tiered structure. Our recommendation was to have that take effect following adoption, should it be adopted by the board. But certainly we can talk about that as well. So with that, I'll turn it over to Kate and have her elaborate on the discussion, although I probably stole a lot of the thunder.
You did, but I'm okay with that. I think the primary guiding principle that I just want to make sure that we're all level set it on is the idea that we are recouping the cost of our work through our fees. That is something that since I've started here has been really the driving principle. And even in 2023, when we did do a full restructure of our fees, that was what we looked at first, was how can we ensure that the staff time to operate the licensing program in totality, which isn't just going out and doing inspections, is covered through the fees that we charge. And then, as was noted by one of the folks during public comment, we added those other layers of how do we make sure that it's as consistent as possible across our licensing categories as we can, knowing that different types of licenses have different types of requirements. So it's not going to be fully consistent, but how do we get rid of some of that complexity and inconsistency that was present before the board approved the full overhaul of licenses in 2023. In terms of, our historical experience working with temporary tattoo events, it's limited. We've had a couple of events here and there, typically with only 1 or 2 establishments attending. This is definitely the first time we've had to apply the way that these licenses have been issued in the past in a scale this size, which is why we looked to counties who have similar directives as ours to cover those costs. I think fairly we cannot inspect 100 folks' setups for tattoo or piercing with a $200 fee. It's not, we don't inspect that quickly. Probably a good thing for the health and safety of the public. So again, looking at other counties and how they set up their fees, this is reflective of how others do it. It's also reflective of the fact that tattoo shops usually are comprised of independent contractors and not employees. So looking at it as there's somebody in charge, there's up to 6 practitioners underneath that person in charge. That person in charge could be the same person for every application for a large event. But again, it's reflecting that right sizing while still covering the costs that it takes for us to do the work to administer a licensing program for Marathon County.
And Kate, do you want to, I'll just pull up the budget as well, because we have the memo on page 214 of the packet, but the budget book has the existing fee, and I didn't look at this before, but one of the pieces that was referenced during public comment, the proposal doesn't change the existing fee, please keep me honest, for an establishment with 6 or fewer practitioners. The fee is the same currently if you were inspected in March of this year as it would be for the rest of the year. Is that fair?
There is a decrease, actually. I can't see that. My eyes are not as good as they once were. Welcome to the 40s. I mean, I'm mid-40s now, but I pretend I'm young. So what we did is we said, if up to 6 people take this much time to inspect, we can apply that whether it's a temporary situation or a permanent situation. We have chosen, and we are proposing to say that whether you are all tattooers, all body piercers, or a combination, that is irrelevant. We're there, we're inspecting. The code is, obviously slightly different whether you're a tattooer or a body piercer, but it doesn't fundamentally make our world more difficult. The only other thing that I would say about how fees are established, if we have an increase in our fees are on a fiscal year, our licensing is on a licensing year, and those things do not align. So every year we have people who may have purchased a license at one point and paid one amount, and then purchased a license at another point and paid a different amount. That's consistent since well before I was here.
So just to clarify, there's not a substantial increase based on the change if you're a permanent establishment? Or am I, because I'm looking at the budget book has, right now the existing fees are the far right column.
Yeah, I think we'd be down to 208 for every fee.
Okay.
So it's a decrease. It would be a net loss if we had a normal year of $400 is what I estimated. So negligible. But of course, if we have a large body art convention in one year and then not another year, we will have differing revenues because of a large event. Okay. But we've held about 32 permanent licenses for quite some time.
I just wanted to make sure we're all on the same page, that
Yep.
It's not an increase for those already existing permanent establishments under the proposal.
Correct.
Are there any questions for Okay, so is the proposed fee schedule based upon, given the Cedar Creek Ink Fest, what your anticipated time would be associated with the,
If we had 6 licenses on each, or 6 practitioners on each license, I think that's around $33 per practitioner. I would say that would be a very low estimate of what it would actually take us for the prep work and then the on-site inspection work that we do. But again, we don't always contemplate our fees as being exactly fee for service by the minute, if that makes sense. So we feel that it will be fair to our level of work as well as for the operator and practitioners, depending upon how they choose to administer that fee to the folks coming, that it's not, too much or too little.
so if we were to defer the effectiveness of this license change to hypothetically November 1st, how would you treat that festival?
Yeah, so the way that we've always licensed these events, and like I said earlier, we have only minimal experience working with temporary events. They're small, 1 or 2 shops. We consider an establishment the establishment that is coming. So if Kate's Tattoo is coming and I have 3 practitioners, I pay for a license for my 3 practitioners. If Lance Tattoo comes and he has 4 practitioners, he also pays that amount. So it's based on that establishment rather than being based on a generic number or a conglomeration of 6 practitioners coming together under a single license.
So just asking a clarifying question.
Yep.
So if there were 100 shops coming,
Yes, we'd have 100 licenses.
licenses, under
Yes.
the proposal, we would have 100 divided by 6, assuming they
Licenses.
did it with 1 person over all the licenses.
Yeah, or over each one of those licenses, but yes.
So I'm seeing some heads nodding or disagreeing with that comment, so I want to make sure that when we vote on this, we have a clear understanding of what the consequences are. Vice Chair Poole.
Sure, just for clarification also, I think the fee structure makes sense to recoup our money. However, implementing it on short notice, if it's going to affect them negatively, 2 months away, I don't think that would be fair, so I'd be for after. However, if you're saying that it's actually cheaper if we do it this way, that makes sense, and I just want to clarify that that's right. If we go with the new fee structure, it'll be cheaper for the event than it would be.
Do you want me
Based
to-
on our interpretation,
Yeah,
Yes.
if they group together in groups of 6, based on the information that we've been provided by the operator of the event, it would be less. They have more than 100 divided by 6 number of shops coming. So if they all group together in groups of 6, it would be a lower cost for the event.
So I thought what I heard was that there would be 46 to 60 vendors. So we would be looking at,
I don't know exactly. I haven't seen a roster or this is the number of shops that are intending to send 1, 2, 3, 4, 5 practitioners. I just know that average shop sizes in Marathon County are fewer than 6 practitioners. Based on the information that we receive when we are at body art shops, and we have to ask for their practitioner license information because part of our inspection is to verify that they have a up-to-date and fully paid DSPS license. So we do track that data, but it is dependent on the operator telling us how many practitioners they have at their shop.
Chair Gibbs.
Just a question for clarification. So if I have a establishment that's already licensed in Marathon County and I attend a temporary event, do I have to get another license?
Yes, you do. Whether you go to Marathon County or you go to the city of Milwaukee or you go to Dane County, wherever that temporary event is, you need a license. And it's in part because of the inspection and There are different requirements for those kinds of events.
Are there any other?
And just for context, this did go through Health and Human Services last week as well. It would require board action.
Are there any other questions or discussion? If not, what are the wishes of the committee? I'm sorry, you may? Okay, we have a motion to adopt the policy. Is there a second? Second by Chair Gibbs. Any discussion on this? I sense that there is potentially some confusion and disagreement between your comments and their body language. They don't want to be pierced by this. Even if it is adopted today, it would need to go to the board, so we would have time to reconcile any differences, if there are differences of opinion as it relates to this. Because I think what the health department is saying, this is actually a reduction in fees relative to their understanding of administration of the code. Is that correct, counsel?
I believe so. I guess it's a reduction if you have, as I understand it, if you have 1 to 6 practitioners, it may increase the number of practitioners you have at an establishment. And I don't know how many of these establishments have more than 6, less than 6 practitioners at their place of business.
Your question. I think the question, if it's about the temporary event, yes, I have no doubt there's a difference of whether it's opinion as to how it will be licensed or how it should be. I'll just tell you that we looked at it, and I'm not going to substitute my judgment for the judgment of the health department professionals about how they would inspect and how they would license the event. I don't know if Kate, you want to talk about, City of Milwaukee, right, uses 8.
Yeah, their license structure is really similar to what we're proposing, but their license structure is up to 8 practitioners and it's $250. So in essence, we're charging very similar if you go to the per practitioner fee if you get to that high amount of practitioners on a license. So yeah, we are modeling this after a county, or really a city of Milwaukee, that does also have a number of large events where they will deploy 16 sanitarians to do inspections. We don't have that many sanitarians.
Any other questions? Not all is in favor, will signify by saying aye.
I,
Opposed, no. That motion carries. This will be on the county board agenda later this month. So if there are differences, we can discuss those between now and then. Thank you. Next, we'll go on back to item 6A1, discussion regarding 2027 budget development and policy recommendations for the committee, including review of mandatory discretionary program document and discussion of rates and fees. And we have a preliminary statement of changes in equalized valuation from the Department of Revenue, as well as a preliminary net new construction estimates, which were included as a link, and then the sales tax revenue updates from PDM.
Yeah, so again, if this is really the recurring item on your agendas for discussion, from a staff perspective, the thing we're doing, as it was alluded to with the health department fees, we're talking about fees as staff. Based on the direction the county board gave through their the budget prioritization exercise with the poker chips, built on a 3% increase in fees. We have circulated spreadsheets to all the departments to take a look at the existing fees that I showed you during the budget when I pulled that up, and identify whether there are certain fees where 3%, a 3% increase does not cover our costs to increase. And make note of that so we can have a discussion with the committee and when we make a recommendation. Conversely, if a 3% increase is not justified by our increase to deliver the service, we're asking them, department heads, to note that. We're also asking them to note if there is a particular fee that is statutorily prohibited from being increased. Jess is here and there are fees, the medical examiner, some of those fees are set by state statute and have specific timelines on when they can be increased and by how much. And then lastly, which of course we don't like because that means less fee. And you'll see that what you see is your months, but we're not far off from where our projection is for 2020. 2027 for the budget. So with that, I mean, if there are any questions relative to budget, happy to answer them, but that's what staff have been working on.
Are there any questions? So the bucket got smaller?
Indeed, the bucket did get smaller.
This might be, right. I'm just curious, you know, we're talking about net new construction and spending that money is basically is kind of what we're talking about. It seems like net new construction and that the excesses or the extra money that the county's going to be bringing in and how we're going to spend that. Is that what I interpreted?
Well, that's what your
Yeah.
bucket challenge was with
Yeah,
the number of
that's-
poker chips you got.
Make sure I'm talking the same.
Yep,
That I
spot
didn't
on.
get off on it. Okay, so I'm just going to throw this out there, but do we have to spend it? Are there any alternatives, any plan Bs, plan Cs?
That's a great question that every new county board member asks, and I tell the same answer to whether you've been here multiple years or Vice Chair Poole brings it up a fair amount. It would be a very poor decision not to maximize your full operating levy every year because you have debt. And
Well, let's pay that debt down then.
yet you can. That's what you do by putting it on the levy. But I believe there's one county that is substantially below their operating levy limit, another that I'm aware of likes to say they are, but they're only very, very close to it. And it's, but yeah, there's nothing that says you can't, but you don't have the money to do that. I'll just be very honest. You don't have the funds to do that unless you want to stop paving roads. Because you got to service the debt you've already taken out. You have 7.7 million, as we'll talk about in a little bit, that you need to service. Your cost to do business, I would not be doing my job if I told you should not maximize your operating levy. You need to do that.
So let me try a different way to answer that. So we have a levy that is set by, we have the most restrictive levy limits in the country imposed on us through the legislature. So we can increase our levy each year. Let's just, for discussion purposes, say that it's $50 million. If our net new construction goes up 1.545%, we can increase that by 700, well,
800,000. It's about 800,000.
$800,000.
Levy.
That's what pays for our increases in salaries, our utilities, our insurance, and everything else. Well, we also have shared revenue coming in from the state, and we have sales tax collections. But basically, those are our revenue sources.
So
If we don't, and at that 1.545, there should be no change in tax rate to a property. The general equalized valuation that he also talked about that went up 6%, that is that the inflation on your house going up. If we could increase it to the 6% that the county would have, we could keep pace with the inflation, but the legislature doesn't allow us to do that. So we should actually see a stable net tax rate for county levy purposes based upon applying that 1.545 against, that, taking advantage of that levy increase. So you were keeping things the same. The house values may go up, but the levy limits keep us from capturing that growth in the equalized valuation of the value of the home.
No, I understand the reasoning. I guess we're driven by expenses, that's private or public, but I guess I'm looking at, trying to push back on that with not increasing our debt, not spending more.
That's great. My ask of then, tell us where to cut, because
Well, in private practice, the boss just says, cut everything 2%, cut everything 5%, and you do it. I mean, we're just people.
No,
We have a
that's
budget.
entirely,
It's not a difficult thing.
no, that's entirely true.
Let me remind you that not all dollars are the same, and we can't cut everything 5%.
No, I understand that.
And again, $200 million budget, $57 million levy. It isn't as easy as making those adjustments.
No, I understand. It never is.
Chair Gibbs.
I think the other point that needs to be made, the 1.545% increase is new property that's being taxed. It is not an increase on my house, because I didn't add anything to my house. My neighbor put up a new garage or a new shed, and that's what's being taxed at that 1.45%. So I always look at it as it's new taxpayers that are paying additional, the same as I am as far as the rate per thousand.
No, I was just going to say, a key difference for me would be if you spend it, you can spend it, but not on new programs, not on new positions. We have plenty to spend, in my opinion, on current things we need. Our spending for these things, our costs for these things are going up faster than our revenues. So I'm not for expanding it into new things, but certainly maximizing what we can, I'd be all for.
Yeah, if I could just add one thing, I think Vice Chair Poole hit the nail on the head. If you want to make substantial cuts, identify where, or if we're going to do across the board, that's where Chair Robinson's point come in. If I cut 5% from the budget in the health department and licensing, doesn't do anything to the levy because it's entirely self-sufficient. For the reasons Kate just referenced, we cover our cost with the program and how we deliver it and the charges. You're not going to modify the levy at all. The same is true with solid waste. They are off the levy. So it's about being strategic and saying, all right, if you want to make substantial impact on the levy, not every dollar is created equal. And it really is that's the reason for the mandatory discretionary program document as well, because there are certain things you are mandated to do. You can make service level changes. I'll bring up roads again. Marathon County, I think, when you travel the state of Wisconsin, I think our roadways are maintained very well. That's board action to maintain them at a PACER rating of 7. If you want to drop it and save, like, hey, let's plow less frequently in the winter and let's have not invest as much in roadway work. And I know Commissioner Lang is on the call and he's probably cursing my name as I say this, but I mean, you can do that. You can absolutely provide staff the direction we want to drop the service level here. To your point, the boss makes that call. You guys are the boss.
I guess the other point, I've been fortunate or unfortunate to be on this board for 20 plus years. And in that time period, just to illustrate how the tax rate is impacted by the levy limits and inflation on homes. Our tax rate when I first got on the board in 2006 was $6.87 per $1,000 of equalized valuation. And I think last year was $3.45, somewhere very close to that. But, so I think what you see from a historical perspective is the ratcheting down of the government's effective ability to raise levy, and that's fine, there's nothing wrong, it's protecting the taxpayer. But at the same token, it limits the ability, and I think Vice Chair of the committee clearly points out, it limits our ability to expand programs. But it doesn't, and the direction that I've tried to, at least since I've been chair, provide to all of the supervisors, if there's something that you want to do less of, let's identify that early in the process. And that's what this reoccurring theme is for each of the standing committees. If there's something that you want to do less of, if you want to lower the PACER rating and do less highway miles and maintaining of our highway system, that's fine. Let's have that discussion. That will give us then the ability to potentially lower the tax rate. But until we actually, and the discussion is on each of those standing committees' agendas every month for discussion. And each month, I don't see a lot of discussion about reducing programs, because the programs that the county has gotten into or where we're at is necessity. In some cases, they are required by state statute. The level is debatable by the board, but there's also discretionary programming. But I think we've come to find that the citizens expect the service level that the county is providing.
Supervisor Hart?
Thank you. And then just to jump on some historical precedents, a lot less historical precedents than the chair, but my first year, I believe we had a net new construction of about 11% equalized value. But I think the discussion, and that was my first year, so it might have gone over my head, was we didn't take full advantage of that.
No, we've always, as long as I've been here, both as the deputy administrator and, well, going back even to as deputy corp counsel, I'm not aware of any year when we didn't fully,
1 year.
1 year where we didn't take for net new construction, but equalized value, to your point, when it grows by 11%, what you see, and you can look in the budget book and there's a really nice graph. What you see when an equalized value grows up, as the board chair referenced, home values increase substantially by a function of levy limits. What that does is it drives the rate down. So when we've had big growth in equalized value, and you have over the last, as you'll see when we talk about the highway shop, the last 5 years, that average is much higher. You had a lot of years where, 2, 3, 4, 5% equalized value. This year is 6.25, down substantially from 9 last year, 11 the year before. So just again, to piggyback on what Chair Robinson referenced, when equalized value goes up substantially, function of levy limits, it's going to drive the rate down. You do get to increase the overall levy by net new construction. That's a smaller number. So this 1.545% is going to be in that $800-ish thousand of new money that you can take in. That is not going to cover the cost to continue. So the other thing that staff are doing, absent direction from, well, in addition to any direction from the board about, hey, let's stop doing a program, what staff are looking for all the time are just the things like Kate brought to you today. Hey, are there ways for us to generate more revenue from fees? Are there ways for us to deliver programs more efficiently? Social services, Krista's here. We've made a number of changes where we used to contract for a service. Family, the visiting program, Youth Opportunity Center. our cost to intensive supervision services, our cost to procure those was growing substantially. So we did the math, developed a business plan and said, you know, we can do this better, more efficiently and cheaper internally. So we take those things in. Health department, we changed from one delivery model of nurse home visiting to another. We went to the nurse family partnership model, substantially decreased costs. So staff are doing those, how can we be more efficient pieces? The real direction we need, that we can't give, that staff can't make the decision, is on what programs or services do you want us to deliver? If there's something you want us to stop that is not mandated, it's entirely the board prerogative. Parks are 100% discretionary. There's not a state statute requirement that you need X number of acres of park based on square miles of county. But as the board chair referenced, the public constituents, if I ask them, what do they really like? Dells of the Eau Claire is probably near the top of the list. But anyway, I could go on, but it's a great question.
Other questions? All right, anything else on the budget or for the budget development and policy recommendations? That will be an ongoing discussion. We'll then jump to number 2, update and potential consideration of new position requests and reclassifications in connection with the development of the 2027 annual budget. Administrator Leonard.
Sure, and I won't, there's a memo in your packet. It starts on page 143, building on the comment from Vice Chair Poole. The direction that the board has given is really not adding a whole bunch of positions that we can't fund. There's got to be funding for them and try to minimize any levy impact. So these are the requests that have come in that first through your process, I review along with the HR director, and then we work with finance to cost them. But everything on this list I've reviewed, our team has reviewed, and we think is appropriate to include in the 2027 budget. Your ordinance also requires, section 4.20 also requires, once that review happens, if administration supports the position, it needs to go to the standing committee of jurisdiction for consideration. That also has happened for every position that is on the list. So the first one on the list is the district attorney's office. That went through public safety and they supported inclusion. You have a number of positions that fall under your oversight as the HR Finance and Property Committee. The only position that hasn't been approved by the standing committee yet is a reclassification within administration, because I'm taking that to executive tomorrow. But with that little bit of background, if this committee were to support including these in the budget, I would do that. You would then receive a budget that had these positions in the budget, which you can always change up until the moment it's adopted. So with that background, I'll start with the district attorney's office. This is a great example of how we try to align our work with funding streams to maximize funding. The district attorney's office request is to abolish a 1.0 FTE restitution specialist and create a 1.0 victim witness specialist and a 0.5 FTE administrative specialist. So it's abolish a 1.0 and you leave with 1.5. And you might ask, well, how are you doing that? That's more money. It's about aligning funding streams. Victim witness work through the state of Wisconsin has a reimbursement. So the plan is to abolish that restitution specialist, delegate that work out from that position to our existing administrative staff within the department, as well as some of it to that 0.5 administrative specialist. We have a need for more victim witness work in the district attorney's office because 2 years ago, a grant-funded position funded by the American Rescue Plan Act funds, that lapsed. Those funds went away, the position went away. They have a need to address that. So this is overall a levy reduction based on it's a projected levy reduction based on the funding streams. Do you have a question?
Yeah, is there any guarantee that we're going to get that state funding reimbursement?
The funding is guaranteed. What's not always guaranteed. It's a sum certain allocation from the legislature. It's not a sum sufficient. So what that means is in practice for victim witness work, my understanding over the last 10 years is that the reimbursement has varied from 40% to about 60%. DA Mayo just came up right before this meeting and said, hey, great news. The 2026 reimbursement is projected at 55%. So short answer, yes, it's guaranteed. The exact amount of the guarantee isn't known.
So the levy savings may not be the 19,000 we're talking about. or
It's
the-
projected, but we're feeling good about the number. I don't know, Sam, if there's anything you want to add.
Yeah, that number is based on a 50% reimbursement of that position. So,
In between the 40 and 60 and less than the 55 that we're getting this year. So great question. Next up is corrections. This is really, we just talked about we talked about unfreezing some positions that were frozen and unfunded as part of the 26 budget previously. This is eliminating an administrative position and creating a corrections officer position, which above all else, it does have a fiscal impact, but it really does allow us to have someone on staff within the sheriff's office to perform all the work that's needed as a corrections officer, as opposed to the civilian position that exists now. Clerk of courts is a reclass from an administrative assistant to an administrative specialist that essentially is moving it up one grade on our pay scale. Little bit of background on this one that I think is important. As part of the budget development at the end of 2025, we did leave a allocated position within that department. I strongly suggested to Clerk Schremp that we not fill that, and she kindly obliged to that request, and that speaks highly of her department. They really worked hard to make something work, and we're still not going to fill that position. It was unfunded in the 26 budget. But we need to make, the recommendation is to reclass that position because operationally it is, the solution we implemented in 25 isn't working great. We're confident we can still not fund the currently frozen position, but a slight reclass I think is appropriate based on our review. And that's the $3,500 cost. That should not have a levy impact because we are having enhanced revenues within the clerk of courts budget based on recent statutory changes from the state relative to reimbursement. Medical examiner position, short explanation, we had two physicians, two pathologists, a chief and a deputy chief. Our case volumes, specifically autopsies, weren't sufficient to warrant building the 27 budget with that deputy chief position. And our deputy chief, that position did vacate recently, so the recommendation is to abolish that physician position. That said, we need to then maximize our single remaining physician position, maximize efficiency there. And to do that, we wanted to add a senior administrative specialist position. That comes at a substantial overall cost savings because that physician, that deputy chief medical examiner position was substantially more expensive, as you would guess, from the senior administrative position. One point of clarification, we costed that vacant position at the midpoint for the deputy chief medical examiner position, not at the entry level or not at the rate that the previous incumbent was being paid, because that's our standard practice. And the reason for that is that when a position is vacant, you really don't know who's going to apply and who you're going to hire. And it doesn't do any good. It's not a sound budgetary practice to budget and estimate costs based on the lowest entry level pay position on that pay scale, because if you get somebody with 15 years of experience, you're not going to be able to bring them on at that introductory starting rate. So we, as standard practice, cost for any vacant positions at the midpoint and with family insurance. But again, that position recommendation, it comes at significant overall savings. Administration, the reclass of a position, this is largely driven by, again, reclasses are driven by the work changing. In '24, the board amended your existing ordinances to really vest administration with oversight of the tax foreclosure process. That has lived within a senior administrative position in my office. We've had great success with that approach. However, those increase in duties really do warrant a reclass based on the job the person is doing. The fiscal impact is quite small, $2,143. That will be covered by existing budget within my department, so no anticipated levy impact there. Health Department, the first one on the list is abolishing a lab tech and creating a sanitarian. This is really just putting on the org chart something that we piloted as part of the 2026 budget. That's working well. So again, no fiscal impact in terms of change from what is currently being budgeted because we piloted it in '26. Reorganization within the fiscal services side of the Health Department, abolishing a business management position and creating a senior administrative position, at the same time creating a position within Sam's office in finance to do accounting. As I put in the memo, we've historically had business managers that the goal was to have someone who really understands finance, has a finance background, and really understands office management, managing people. Those are hard to find. We've moved away from that approach in a number of other departments. This is consistent with that. This does have a fiscal impact. However, I will say, similar to what we talked about with aligning funding streams in the DA's office, the expectation is that we would minimize levy impact with this reorganization because we'll make sure we'll have someone who really is sound on the finance side to align our work to the revenue streams and make sure we're billing appropriately and seeking reimbursement from grants at the maximum level we can. Social services, a child support realignment. Won't go into that in detail other than it would require abolishing a specialist position and an administrative position to create two different positions. The maximum restructure amount would be that $26,000. However, again, because of reimbursements for the child support program, the actual levy impact is reduced to $9,000. And one other piece of background that I think is really important. A couple of years ago, we restructured that department to downgrade the child support manager position to a supervisor position. That came at significant cost savings. This is really also related to that. I mean, we need to make sure the scope of control and supervision within a department is appropriate. We're still coming out, if you roll in the savings we previously saw from that, we're still below what our previous levy was in that area. Again, I support this reorganization. Social Services has done very well to be fiscally mindful in how they set up their and organize their departments. There's no need to have, we anticipate covering this within the budget. Economic support, these are simply a reclass. It'll all be covered by grants, so no levy impact there. We have a conversion from a limited term position to a full-time position, no fiscal impact there. It's going to be covered through consortia funding. Children's long-term support, quite a bit of new positions there that are funded entirely through reimbursements through Medicaid, not requiring any tax levy. And again, this program is a mandate that counties have to deliver it. And we need to make sure that we address the wait lists that exist for children and families that are seeking these services. We can't have a wait list that exceeds the directives from DHS. So we're not going to recruit for all these positions all at once. We would stagger those based on need. but that's the nature of that entire program. And then last but not least, we have within facilities and capital management, abolishment of a 1.0 FTE building maintenance tech to create a building maintenance specialist. It's not anticipated to have any budget impact overall because we anticipate some impending retirement that will, when we refill that position, we'll have more than enough funds to do that. This is a good thing. It's from a professional development standpoint. One of the things we frequently do is if we have a higher level position, in this case, it would be the building maintenance specialist position, is we often underfill those positions if someone doesn't have all the requisite skills and training and experience that would be required for that placement. And then over time, we underfill it with a technician. And over time, should they obtain those credentials or additional training, they would be able to move into that specialist position. It's worked very well at the airport. We have what are called operations and maintenance technicians at the airport, and there are 4 levels to those. So it's achievement-based in terms of advancement. So I know that was a lot. In terms of new positions, we have, I think, pretty much everyone that, every department that's represented on the list is here. So if you have questions, we'd be happy to review them.
Mr. Leonard, I do have a question as it relates to particularly those that are grant funded and in particularly social services. Are those some certain or some sufficient appropriations or underlying those agreements?
Krista, do you want to talk through? So that's CLTS, those positions, we essentially reconcile at the end of the year. The positions are fully funded based on our cost, correct?
Yes, the positions are fully funded based on our cost because we require that our social workers have a certain amount of billable time to each of those cases, which is 65% a month, to ensure that all of our costs are covered.
So some certain, or some sufficient, I'm sorry, some sufficient.
Right.
Yeah. I would say based on our productivity measures, they are some sufficient, but not in the technical accounting sense. It's not some sufficient. If we had a really bad, if we weren't meeting our productivity standards,
Then we would reconcile those costs at the end of the year, right? We come back to the state and we share that our costs weren't fully covered because CLTS is intended to be a fully covered program. So then we reconcile those costs at the end of the year to make sure we're fully reimbursed.
Other questions as it relates, Dave?
Yes, so how many total new positions are there? I mean, it's kind of a, I know there's a kind of an exchange there. You're
Yep.
repositioning or you're renaming some positions or creating some, I'm not talking about the one-for-ones. I'm talking about the actual new. I get the one-for-ones.
So there's one new position within the health department. That's the separating the business manager and the accountant position. And I'll look at that in a minute, but really it's the social services ones. That's it. Everything else is essentially, and the DA, thank you.
Plus one in the DA? And how many in
Plus
so?
0.5, plus 0.5.
Half one? So how many in social services?
Well, we would stagger them in terms of when we would bring them in, but the CLTS section where the request is 5 FTE social worker positions, 1 lead, so a total of 6, because the other one's a conversion.
6, so you're talking about actually creating 7.5 new positions.
Let me look at the health department one, but for sure the 6 in social services that are fully funded, the 1.0 FTE becomes 1.5 in the DA's office, so that's a 0.5. And the health department, we are abolishing.
The lab tech.
Well, that one doesn't count. Well, it would be the 6.5 if you count the fact that in the health department, we are abolishing an unfunded position. So
So 6.5 total?
6.5 total new positions.
Okay,
Again,
so,
depending on how you count, but the social services are fully funded and the DA's office is a wash in terms of cost.
okay, so what is the net on the cost of all of this?
It's gonna be down.
Will
In
be
terms of
down?
levy, are you
Yes,
talking levy?
yes.
For sure it's down because
The
the
big
medical
one.
examiner position is a
And
big
that-
number.
And that medical examiner position, you can just wipe that out, change it by, without board authorization or anything like that? or
No,
that-
that's why I'm asking.
That's a done deal?
I'm asking for approval to abolish them, all of these. I
Oh, so
don't,
these would be like separate items?
you can make a single motion to move them forward in the budget, but I don't have the ability to abolish a position or certainly not to create a position without
That's
board
what I was
authorization.
wondering, because we said we're going to get rid of it, but it hasn't been approved yet.
Yeah, the ones that were, the medical examiner position, just for reference, is unfilled right now. The
Okay.
deputy chief position. I do hold open positions frequently.
Okay. My comment is that it seems premature right now to make a decision on this, because a lot of this stuff the dust hasn't settled on it yet. I mean, we have a lot of should get the funds, not as, hopefully, I'm hearing a lot of, not a lot of clarity in some things, so it seems like the dust hasn't settled on some of this stuff yet. So I feel a little hesitant to take these all as one, seems a little fast, I guess. That we should probably maybe not take them all as one, especially some of them that need approval yet.
Supervisor Hart.
Thank you. Then I'd ask, what are the ramifications of not including that in next year's budget?
They wouldn't be in there. So your ordinance requires this process. I would respectfully, I think you know enough. You're not going to know any more on any of these things. You certainly can take them one at a time. The district attorney's position, in my mind, I don't think any of these are difficult decision. The district attorney's position is a great move. It's going to be less levy impact, hopefully, and it addresses an operational need. Similarly, the corrections officer position. Corrections is a very challenging field, and we need to make sure we have enough corrections officers to not have to unduly enforce overtime or require deputies to work in the jail at a higher cost. So eliminating that administrative position and creating the corrections position, I think is very sound. The reclasses that I referenced, those are driven by work. You have people doing a job that, based on our methodology of job classification, the work they are doing should be paid at a level on the pay scale. So again, I don't see those as overly.
Let me try to set some historical setting to this issue. This is part of the budget process, and our ordinance and our policies direct the administrator to bring them in this manner. In the case of the DA, sheriffs, and courts, those went to public safety, they were all approved. In the case of those affecting Health and Human Services Committee, those have gone to that committee, and they've been approved and recommended for us. In the context of most of these, there are levy increases associated with reclassifications. At one point in time, we dealt with reclassifications on an as-needed basis in the course of the budget. This process focuses them all into the budget cycle so that we understand those and we can build them into the budget. This is a budget planning tool that allows the administrator then to proceed with incorporating those in. In several cases, we've already, as a board, taken positions on some of these new positions, the 7 positions in social services, I think went through the board earlier. So we've already approved those positions. This is just bringing them in and incorporating them into it. So many of these items are not new. They've gone to other committees and they've received their stamp of approval. The one that is before this committee would be the Facilities and Capital Management, the abolition of the one building maintenance tech and creating the building maintenance supervisor. The rest have all been through the other standing committees. So again, we're trying to build, at one time we were dealing with these all too often. I think Chair Gibbs was chair of HR Finance at that time, and the desire was to collect them and run them through a standardized, streamlined process once a year. So by the way, Chair Gibbs.
I think the other thing that this process tried to establish was, and Chair Robinson clearly is accurate. When I chaired HR Finance, we would be dealing with reclasses on a various, throughout the year. And so there was never a comprehensive look at the totality of new position requests or a comprehensive look at the total overall budget. What this process does is forces the process to be looked at by administration first, reviewed by professional staff to understand the business necessity for each of the reclasses or the positions, and then take it to each of the standing committees, and then bring it to this committee for overall look at the overall budget build. And so I support the process much better because there is a comprehensive look at the total overall budget that the board is in charge of at one time, rather than at various times throughout the year when we would have a business need from a department coming to the HR Finance Committee without any comprehensive look at the total overall budget.
So I understand and appreciate the process. However, I've never seen any, I guess I'm not aware that any of this stuff has been approved by different committees. I'd like to see that, which ones have or which ones haven't. And, trying to understand this more before I cast a vote, I'd like to table this and be able to look at it.
Chair, I believe that we're required to take these to the board as part of our process or not?
Yeah, I suppose eventually we would, but at this point, at this juncture.
Great question. So all of the positions that, I'll hope to hit on all of the answers to your questions. All of the positions except the abolishment of the building maintenance tech and the creation of the building maintenance specialist have been approved by a standing committee because you oversee facilities and capital management. And the second one is the reclass within administration because that goes to executive tomorrow. All of the other positions, so numbers 1, 2, 3, 4, 6, and 7 have all been previously, and all of the subparts underneath all of the others have gone through the standing committee approval process. And you certainly can take them separately. You certainly can table it. I'll just tell you exactly what I'm gonna do. I have to build a budget, and you guys and the board likes to have that timeline where I deliver it early. Sam and I have budget meetings with departments starting Monday. So I need numbers to put in a budget to give to you. These are all gonna be in there. Because I need to finalize a personnel budget. So if there's something that we don't want in there, I can do that. But this does not go to the full board. It goes to the full board as part of the overall budget. So I build a budget, I turn it over to this committee. This committee then can make changes. The budget then is published, and then it gets considered in November. So to your point, I think you certainly can separate any of these, but we need to build a budget, a personnel budget, based on the approved allocations within each and every department, consistent with statute.
But how can you do that if we haven't overruled the previous board's, their regulation or they was it on here, that they didn't approve anymore on July 28th, 2026. The direction was that the proposed budget should not provide for new positions that require additional levy beyond budgeted compensation. So no new positions and nothing beyond any levy increase. No, there's not going to be any levy increase, it sounds like. That's if everything falls into place.
Correct.
And we don't know that.
Don't know that, though.
True, but
What's
you
that?
won't actually know that until the
Right.
audit of 2028.
Right.
So respectfully, I mean, this is,
I get that.
you're trying to make, I think everyone is trying to do the best job they can with the information we have.
But I mean, we'd have to first, the board would have to override that July 28th, 26 regulation, wouldn't they? Before you
was-
can add more people?
That was the direction through the budget assumptions, when you
Okay.
put the poker chips in the buckets. The direction that then came at your voting meeting last month, it was 3 weeks ago, was no new positions that require, the language that require levy beyond budgeted compensation increases. And my assessment is these are going to be covered by
Okay.
the levy allocations that we expect. Great example is the clerk of courts. We have enhanced revenues in the clerk of courts based on the legislature graciously making some changes to our split. So we should cover those increased costs for that reclass with that revenue. Same thing in administration. Our budgeted increase for the compensation increases and my already existing budget for the limited term and casual employee fund that I hold is easily going to cover that couple $1,000 reclassification. I hope that answers the question, but you don't need to, the board doesn't need to overrule some previous direction. You set the budget in November and you approve new positions in November.
Chair Gibbs.
Matt Boots has just texted me, he wants to speak, he's on,
Vice Chair Boots.
good, I'm muted.
Yeah, I must have been muted. I tried to unmute here, so I must be muted through the system. Can you hear me now?
Yes, we can hear you.
Okay. Yeah, so I guess I was gonna add to that is that yeah, this has already been vetted through Health and Human Services. And it was a 7-0 vote saying yes, these need to move forward. So we're kind of, I think we're not going through the process the way we should be if we're gonna be postponing it when it already went through a standing committee and it was 7-0. If it was going to be debated more, I think you would debate it at the full board during the budget process.
And I'd encourage any member that would like to go back to the standing committees, go back and look at the WebEx recordings, but there was action taken by all of them. One of the reasons we meet late in the budget, in the cycle, was we meet after the other standing committees, but before exec, was for the very purpose of allowing us to look at the actions and the activities of others and capture those and put it on the agenda as appropriate. Vice Chair Poole.
Yes, after this goes to the full board and before the budget, the full board will have opportunity to look at it and disagree with any of the spending. I mean, there's a few items, new positions, and proposals for spending that expand the scope of what we do in the county that I'm not going to be in favor of. I know that, I don't know if the rest of the board, how they'll view it, but I think there are things to look at and there'll be opportunity before we finalize the budget to eliminate or add other proposals. Thank you.
Chair Gibbs.
Yeah, just to reiterate, I think what's been said, I attended almost every one of the standing committee meetings and I think Chair Robinson of Finance did as well. Each one of these, other than the administration's change and facilities and capital management, had lengthy discussions on each of these proposals. And approved. I don't believe any of them weren't unanimous in each of those standing committees. So I am in support of approval of this as a tool for the administration to build the 2027 budget. And so I'll make a motion to approve the reclass and changes in new positions for the 2027 budget building process.
Would that be, let me just ask a clarifying question, contingent upon executive approving the change to the administrative?
Correct.
Is there a second? Second by Supervisor Hart. Any discussion? And again, this is the start of that planning and building that budget process. There will be ample opportunities to make modifications in the future. Any other discussion? Not all those in favor will signify by saying aye.
Aye.
Opposed, no. That motion carries. Is Supervisor Zhang on? All right, we will move on to,
Just a comment, if I could.
go ahead.
But next time something this comes up, let me know that, or let people know that it's already been pre-approved. I mean, I didn't know that.
Yep.
I had no idea this was already pre-approved by different committees, and I had no idea. It didn't appear that way.
Apologies, I thought I said that when I started, but I must not have.
All right. That takes us into the July claims and question costs, which were sent out on Sunday, the 9th. 1,501 totaling $685,665-ish. And we said if we could avoid paying health insurance and for asphalt, we'd be in much better position. But I don't think we can avoid
Paying the bills.
doing that. Are there any questions relative to those claims? If not, what are your wishes? Chair Gibbs?
Motion to approve the claims and question costs for July of 2026.
Great. Is there a second? Second by Supervisor Nystad. Any discussion? If not, all those in favor will signify by saying aye.
Aye.
Opposed, no. That motion carries. Next is our claims disallowance. And Dave, Sarah, this is the first time you've been through a claims. Can somebody give a quick overview on what we do with these for the benefit of our new members?
I think he says that looking at me.
Looking at somebody.
Yes. There's a statutory procedure whereby people are required to make claims against the county for damages, injuries that they believe have been caused by the county. That gets presented to, legally, it needs to be presented to the county clerk's office. We then send that to our insurance company for them to make a recommendation on whether or not the claim should be disallowed. There are certain timeframes that come into play. Someone cannot sue us within 120 days of making that claim to the county. If we disallow that claim within that 120-day period, that means that the time they have to actually file suit is cut down to, I believe it's 6 months. So it's kind of a process that we have to go through when people make claims saying that, you know, we've injured someone or caused them some sort of damage. I would note that these restrictions and this procedure only relates to state law claims. It does not relate to any claims that someone may have under federal law, such as civil rights claims, things of that nature. So there's your brief description.
So you understand the role? All right. Then we have claims disallowance for Schillinger.
I would note our insurance company has instructed that this claim should be disallowed. So if someone would make the motion to do that, we would then, if it passes, send the person notice by certified mail that they have been denied. And then the process will take over from there.
Me, Supervisor Watson.
So if you vote to move to approve the disallow, like, is it positive? Or do we approve the motion and then vote against it, or
I
that's
would
just
say the
something
motion,
else?
you'd move to disallow the claim.
So that would mean,
Yeah.
okay, and then you can vote yes or no. All right, thanks.
So what are your wishes? Chair Gibbs.
Make a motion to disapprove the claim, the Schillinger claim.
Is there a
per-
second?
Per our insurance carrier's recommendations.
He said disapprove, but I assume he meant disallow.
Disallow.
I would second that disallowment. Wow, that was loud. I would second that disallowment.
Any questions relative to the disallowance of claim? If not, all those in favor of the disallowance will signify by saying aye.
Aye.
Opposed, no. That motion carries. That takes us to 6B1, resolution authorizing staff to proceed with Phase 3 construction of the proposed new highway facility. Administrator Leonard and
This will
I'm
be-
sure
Yes.
others.
Yeah, this will be a team effort for sure. It's an interesting meeting today. Get to talk about equalized value, net new construction, and a whole lot of interest rates and financing talk. So the presentation in your packet starts on page 163. It should, for those of you that have been on the board were on the board last year, should seem and appear familiar to you because it's copy and paste job from the January presentation to this committee. We're just going to go through a couple of slides, but we want Chris to start with kind of bringing you up to speed on what staff have been doing relative to the planning based on the previous direction from the board to move forward with construction planning. We've done a lot. The little bit of background, the resolution in your packet really does, at its core, two things. It will direct facilities and highway staff to move forward with continued finalization of the design, and then to release the bid package for that. And secondly, it provides direction to administration and to finance to build the budget with a general funding strategy, and we'll talk more about this later, but a general funding strategy of moving the already existing debt that the county has issued, that was to finance a portion of the work done at the Lakeview campus, specifically the North Central Healthcare facilities, move that debt from being financed and serviced with North Central revenues and move it to the debt levy. And we'll talk more about why that is. But those are the two things the resolution that is in your packet essentially does. This was previously taken earlier, it was last week, previously taken up at the Infrastructure Committee. It's a very similar presentation, same slides, same resolution was taken up at Infrastructure and was moved forward, but it's also here for your consideration. So with that, I'll have Chris kind of talk through what he and his team, along with Kevin and staff from Highway, have been doing relative to construction planning.
Okay, thank you. So yeah, real hop, skip, and a jump through where we've been since the board authorized staff to move forward with phase 2 of design, which is effectively getting through to design development phase and getting right up to the cusp of and starting construction document work, which is all geared towards setting up that eventual bidding part of the project. The project itself, and with the architect and construction manager, has been moving along according to schedule, so that's been very good. We've been able to plug in all of the different parties, whether that be county committees or Village of Cronenweder committees and boards, to shepherd the conversations that need to be held in each of those places along, and that's gone well. We've been doing a lot of plan reviews, which is, looking at the full set of plans and going through each sheet to identify anything that may be a discrepancy or something to tweak or change. The plans, especially in the early phases, also went to highway staff who got a chance to look at everything. And, long story short there is you want to make sure that the end users can have some input into the space that they're going to be utilizing, because ultimately you want to make sure that, their work and what they need to do is facilitated by what you're designing. The most recent steps forward have been with the zoning change for the parcels the county owns for the project, and the site plan approval process. Those are both ongoing through the Village of Cronenweder. The zoning change process is completed, but the next phase is taking that site plan approval through to ultimately get their stamp of approval on the plan, as it were. The village has been great to work with. Their staff have been assisting us throughout. We've been meeting with them pretty regularly, and then we tend to have 4 or 5 folks show up just in case there are questions about any particular angle of the project when they have their meetings. The site, earlier this year, highway staff and we did do some minor contracting to do some preliminary clearing and grubbing of the site. That included some home demolitions of the homes that were there, and one of the homes that was on site was also purchased and moved off of the property to a location nearby. Overall, the design phase is pretty close to completion, with the final steps including the generation of construction documents, as I alluded to before, and then the schematics and specs that would inform the bidding process for each of the divisions that would be a part of the project, should it move forward. The bidding process right now is looking at it would take place in September, with part of that process being the generation of guaranteed maximum price. You'll hear that referred to as a GMP. That there may also be need for value engineering, which is effectively, cost change through cuts or design change. So maybe you need to tweak something, or maybe you have something you've bid out and then you've included a couple alternates. And so then, contractors and others will bid each one of those, and then based on where the numbers come back, you make some choices once you know where people are coming in. The resolution in the packet doesn't allocate any funding, or it doesn't imply that the project is approved. Rather, it's just seeking, as Administrator Leonard said, authorization to complete the balance of the pre-construction processes so that the GMP can be generated, and ultimately we would come back to the committee and county board with a final project presentation, which would include a final authorization for the project to move forward, and for the county board to consider that. The resolution does reference that being in October, no later than October 15th. That's the date of the county board's education meeting. So assuming everything goes forward, we would wrap up the final stages of planning, and then go through those processes to come back with a fully fleshed out, here's what it is, for the committee and county board to consider a yes or no on. And that includes the funding strategy, which Administrator Leonard alluded to, which we'll discuss here in a minute. But that's the brief summary of what we've been up to.
Thanks, Chris. I'll back us up a fair amount, just again to lay some context. So I won't go back as far as when, as Chair Gibbs referenced, he's been on the board a while, but probably shortly after he got on the board, the highway shop has been, and the relocation of the Wausau highway shop has been a conversation since my first day in administration. And that was quite a number of years ago. That the board has given the direction, like Chris said, we've done a lot. We purchased property in Cronenwetter after a long site selection and study process. But suffice to say, a number of committees have already taken action. The board has previously taken action in other occasions. But as Chris said, this doesn't mean you can always change your mind. We've done a lot of work, but we can always stop. So with that background, let's talk financing, the truly exciting stuff. Sam and I will go through this, and one big caveat to start. All of the numbers that are talked about here were based on, and they were driven by ballpark math and best estimates quite a number of years ago. So with that, we were talking about a $50 million project. So one of the things the board did last year is it took, as part of the budget development process, it took $30 million of highway reserve. And if you all have your color-coded sheets that were handed out during new board member orientation, the fund balance policy, where we took a look at the general fund and the highway fund, and we color-coded red, yellow, green, what all the money in those funds looked like, because as the same analogy is true for the budget as is true for the fund balance. Not every dollar in the fund balance in the fund is created equal. If we have a revenue that is or an asset on the books, you can't turn around and sell that asset without doing or get the dollar for that. You can't spend the dollar without doing a number of things. So you took $30 million from the highway reserve and you set it aside to be used for this project. So what that did, again, using our ballpark math of saying this might cost $50 million, is it left you with $20 million of funding that we would need to figure out how you're gonna procure. The background, there are really only two places you get funds. One, you get them from a budgeted revenue source, so levy, or we deliver a service and we bring in revenue. Two, you borrow. And for capital, particularly for a large building project like this, very often we're talking about borrowing. And I'm gonna start there because I wanna go with, again, a little bit of history here. You borrowed a substantial amount of money. Here's your outstanding debt. Just a summary from your budget book and our audit. Looking from 2019 to 2022, you borrowed a fair amount of money. If you look at this sheet, first year, 2019, 9.5, then 8.5, 17.8, 5.8, 19, 20, just shy of 24, and 19.2. You borrowed a fair amount of money. That was for the Lakeview campus renovation project, primarily. So that's the background. And then the other piece that I'll show you from those borrowings, which is important when we start talking about the strategy we're gonna discuss here, look at the true cost interest rate you got on those borrowings, right in the middle. 1.74, 1.164, 1.65, 1.297, 1.8, and then you go up and you have 3.7, 3.8. You were really good at timing your borrowings, as we'll talk about in a little bit. So, again, the two ways you can finance a project is you either have cash in the bank or you go out to borrow. So that was the direction from this committee and the full board was, what is the way, how are we gonna come up with that gap? And again, I know the gap is not gonna be 20 million based on the work that we've done, but it's illustrative that we're gonna talk about. So with that, I'm gonna jump forward to, what do we look at issuing debt? If we can go to page 165 of your packet. Oh, I already did that one. 165 was what you did. So let's talk about the opportunity for those borrowings. If you go to 173 of the packet, this is scenario 1 that we worked with our financial advisors from PFM. You're gonna go out and you're gonna issue a GO note. What that is general obligation debt. Based on a $50 million project and 30 million in reserves, you gotta issue $20 million. You need $20 million to fill that gap. When you need to get $20 million, that does not mean you issue $20 million in notes. Because, as laid out on this slide, the important takeaway, you have all these other fees when you issue debt. Not substantially different than when you go get a home mortgage, right? You roll in all of the other fees. The same is true when governments issue debt. You have financial advisor fees, bond counsel fees, disclosure fees, rating fees, all of those things there. So when you need to get $20 million, what you really end up issuing is $20,330,000. I only show you that for illustration, that to get 20 million, it costs more than $20 million. So with that, we can go to the next slide, which shows what does it look like when you issue $20 million. And in fact, I think I'll just go to this comparison right here. So when you issue $20 million, the other important piece, you issue $20 million in notes, that $20,330,000. Interest rates are really, really important. As I shared before, you borrowed at some really good times. 1.16, that is amazing. I'm not aware of another county that has a rate that had achieved borrowing that low. So when we talk about what the interest market is today, Sam checked earlier, just looking online, and Sam, I can't remember what you came up with for the rate. Well, is it 4%? So if you look at it today, when our financial advisor, she laid out these 4 various interest rates, just to illustrate the point. If you issue at a 3%, your total cost, the total debt service is $27 million. So you have, in addition to the $20,330,000, you actually spend $27 million. So it's it's $7 million of interest and fees. As interest goes up, this is inherently true, right, in our personal lives when we go to get a loan or a mortgage. As that goes up, the costs go up. So if you issue debt at 4%, that amount goes up to 9.5 in total interest and fees for debt service. And accordingly, it goes up. So let's talk about what the opportunity is for the county. So this is what, if you went and issued debt, let's say you got 4%, you're gonna be paying just shy, 29.5 million. With the additional fees here, the 330,000, as well as the interest. I think everybody, the direction staff got was, is there a better way to do it? So let's talk about what that better way to do to move forward is. Because again, this graph that shows the 30-year trend in bonds, you borrowed right at the bottom. You did really well. You don't want to borrow up here if you can avoid it, or you want to mitigate how much you're going to borrow. All right, so the second scenario, because like I said, you issued all that debt previously in connection with the Lakeview campus remodel, a portion of that debt is being serviced with North Central Healthcare revenues. They pay the county, they give the county money, the county turns around and gives that to the bondholders. So the strategy is, rather than have that cash from North Central go to servicing debt, because again, you've already incurred all of these costs that were on this sheet on here. You already incurred the total interest. You already incurred all these bond issuance costs on that North Central debt. So put that onto the debt levy, transition it over time to the debt levy, and use the North Central revenues to pay for that remaining portion of the highway shop. Some important pieces to that are the growth rate, that growth in equalized value that I talked about, because what that does, as I said before, it is directly correlated with with how our levy is impacted through the rate. And of course, this committee and the board previously, you're very interested in what that rate will be for the taxpayer. So as your equalized value goes up, what you're able to do from these slides is you can transition this middle column here. You can transition, so this is slide 181. You can transition more of the outstanding debt from North Central to the debt levy and essentially hold the rate flat. So you can see, I'll go back up to the slide 179, assuming a 4%, you'll see these numbers are smaller. With a 4% growth in equalized value, you can move $1.67 million onto the debt levy and still hold the rate relatively flat. When you increase that to 5%, not surprising, you can increase the amount you put on debt levy and hold the rate flat. You can get now $2.28 million. So growth in equalized value in that scenario is good. Well, this year we did just get our equalized value increase, right? Showed you earlier in the meeting, it was 6.25. So scenario 2C, you can move just shy of $2.9 million of that already existing, already issued debt. You can service that through the debt levy as opposed to having it serviced with North Central Healthcare operating revenues. Why that's important, again, is this middle column here, additional amounts to be levied. The column next to it, cumulative funds available for the project. Each year, if you adopt that strategy and you move over the full amount You move ultimately to get the full amount of previously issued debt onto the debt levy. That's this third column, the fourth column from the right, 7.7 million. This cumulative funds available for the project continues to grow. And that's where you get, if you needed to get 25 million for the project, you get it right here between 2031 and 2032. If you need 20 million, you'd get it in 2030. So you see the strategy that would exist if we move that additional, we move those previously issued debt to the debt levy. Again, what that does is it saves you the issuance cost and the interest cost. I want to be very clear about one thing. This, similar to what we said in the budget discussion, this is going to, you put it essentially at 20 million or 25 million, whatever the project costs. You're loaning that money essentially from the general fund, because you can see you don't get 25 million right away. You're going to get 2.8. Then you'll have 7. The next year you'll have 11. Then you'll have 15. There's a gap when you needed the money and you need to pay the bills for this project, and you don't have all of the money from North Central Healthcare. So the idea is we are essentially, we would be floating ourselves a loan from the general fund. What that means is it can impact our capital rollover for our annual CIP building through the budget, which you know very well because last year through the budget development, you had $0 rolling for capital, which was hard. We had more than $0 worth of need. So we'll have to talk about how do we handle that. So this strategy doesn't mean you won't borrow. I will not promise you that you do not need to borrow. What it is your borrowing might look different. You might borrow on an annual basis for CIP needs. For a 1-year borrowing is one strategy we could do. And then pay it back, borrow in December, pay back in January, and we'd be able to look each year, how much room do you have to maintain that tax rate? What it would mean is if we moved in this direction, we would negate the need to borrow for the $20 million or $25 million project cost. I know that's a lot, and it's complex, but you're in a good spot. You borrowed. I hope everyone can recognize where you're at with that opportunity. You borrowed at generally around that 2% average. That's a really, really good spot to be in. So Sam, what did I miss?
If you go back to the chart that shows the 20 million at the 3, 4, 5% rate, and then kind of input that savings at kind of essentially borrowing at this interest rate at a much lower rate. So in here, when we talk about the 20 million and it was 4.5%, so like right in between those two, about $10 million would be the true interest cost. If we utilize the funds from the borrowings that we did for the North Central Healthcare remodel, that was at between the 5 issuances, there was 1.164 up to 1.885. So even if you took the 10 million minus the 6 million, that's $4 million savings, just on quick, simple, easy math over a 20-year borrowing there. And then the other thing just to note is on the other chart there, where we were talking about keeping the stabilized tax rate. Thank you. When you look in the upper left-hand corner there, there's going to be some numbers that are somewhat important. So it's going to say 1.75. That's what we were figuring net new construction on operating levy. So we already kind of figured that portion in there. Because it is much smaller this year at 1.545, you'll actually be able to put more than just that shy of 3 million. So there again, it's not a hard, fast rule. Some of that's going to be dependent on other conditions.
Again,
Just a quick question on the funding before we get into the resolution. If we do a traditional borrowing, it would be like for a 20-year note. If we borrow from ourselves, as you said, give ourselves a loan, how long would that take to pay ourselves back? Is that a depends kind of thing, or?
It's a great question. So the way, and Sam, you can take it, but really that's looking at these various tables. It does depend on how much what our equalized value growth is going to be for what that impact is going to be on the tax rate, as well as what our net new construction is. But essentially, you get the 25 million, assuming we have 6%. So let's make a couple of assumptions. Like Sam said, this assumption in the top left corner. Let's say you have 6% equalized value growth every year and you get 1.75% of net new construction. Your library levy goes up by 2% and you want to hold the levy rate, the mill rate flat. You get to $25 million or right between $2032 and $2033. Is that how quickly we're going to get there? It's going to take a number of years, which those are going to be tough. That's the hard part. It's getting to that is the hard part, because then after that, you're in a much better spot. I mean, I think Chris is going to be a much happier human when you get to that year, because we're going to have all this North Central revenue that we've transitioned to debt levy is now available for capital projects, which is great because you have a lot of capital needs. And you want to put off that addiction to annual borrowing as long as you can. Absent levy limits changing, I don't think there's going to be a county in the state of Wisconsin that, I mean, they're not going to last forever. You're going to need to, people are going to need to transition to that, but I hope that answers your question. Sam, is there anything you wanted to add?
No, I think you did a good job of covering it. Like you said, if you continue the strategy beyond that repayment, which is 2032, that's almost a guaranteed 4 million in CIP plus whatever rollover funds would be available at that time.
And it gives you a really good opportunity for the next, if you have a big project, timing your, what I think, as your administrator, one of the goals that this committee should have is time your borrowing so that you don't have a spike in tax rate. Most counties, when they go borrow for, let's talk about Wood County, built a brand new jail. Their rate goes up because you had to get 80 million or $100 million onto the levy. The only time you don't, again, Marathon County got very lucky. Your rate was good because you timed your borrowing at a really good interest rate time, and equalized value went up a lot.
I'll move to approve going ahead with phase 3.
Mr. Chair.
Yeah, I'm actually here because I watched the infrastructure meeting and I was hoping we could just address the whole geothermal solar discussion. If that's inappropriate, sad for me that I stayed here the whole time. I can save it for the full board, but
What is your question specifically, just so I make sure I'm aiming at the right target?
well, there was a phrase you used, I've forgotten what it was, but it was essentially, we're
Oh.
not seriously considering solar, but you're moving forward with geothermal. And I guess, I just have some questions. First of all, I don't really understand geothermal, I think, but from what I do understand, it's an energy hog. It's a, electricity hog. And what what I would wonder is why we wouldn't pair solar with it. The other question that I would have, I mean, again, we're in a planning stage, and you had said nothing is going to move forward yet. Lance just said you can stop at any time, so I think we're still in planning stage. I guess I'd just like to have the reassurance that we're looking at the right energy. And so, have we considered the cold heat pumps, for instance? If we are already doing a furnace, could we replace the cold heat pump with the air conditioner, and then we use less of our furnace? So I guess that's just what I wanted to get clarification and possibly education on, because again, I'm not an expert on any of the HVAC or energy systems.
Sure. So what I said at infrastructure is that we didn't pursue it in earnest. And in my head, what I was thinking of is in the same way we were looking at geothermal, but I understand that came across the wrong way. When we were in the early stages, we did look at solar applications, we looked at geothermal, we looked at what are the options, and that was kind of our charge to the architect and construction manager to say, like, what are the things that are out there from an energy perspective that can make sense for this project? And so through a lot of those discussions, we opted to focus on the geothermal for a couple of reasons. We also decided to gain some efficiency by modifying the building envelope because that's going to help the geothermal again. Now, in terms of Energy Hog, I do think that, geothermal systems, you can have a ground loop, which is more of a vertical loop. Sometimes if you have a broad area, you can have a horizontal loop. If the design is not done correctly, that's when you get the Energy Hog piece, because the auxiliary equipment that should be there to supplement what that appropriately designed system is doing are going to be kind of plugging in on the margins when it's done well. If you have one that is not done well, then it's certainly true that you're going to have those auxiliary systems working a lot harder than intended, because the thing that you built, the ground loop, the number of boreholes, the capacity, the tonnage of chiller or boiler equivalency you're aiming for that facility is not sufficient for that system. And so that's where you bring in the folks who are the geothermal, so to speak, experts. They've been out there and they've drilled some test holes to figure out what's underneath the ground, essentially, in terms of soil profile, in terms of where's bedrock, where's water. So you get a sense of, okay, if we're trying to aim at 350-ton chiller, then that's going to require X boreholes this deep with this much water with this pump, which then circulates through that. The thing with geothermal, when it's designed well, is that the efficiencies you can realize are arguably better than conventional systems. Now, conventional systems, they're going to have their problems too. So, there's no free lunch in any of this. But the thing with the geothermal too is that it when it's done correctly, it's working 24/7, 365. It doesn't require any particular weather. It doesn't require anything because everything's happening beneath. It's taking advantage of the temperature beneath the structure. So that's a plus in terms of what it's trying to do. There is usually a higher upfront cost for geothermal, which is why a lot of people do not go that direction, especially even in your home. Like the cost of that would mean like you'd want to stay in your home for 25 years to really get the ROI stretched out and be like, all right, it made sense to me on the front, when I invested in this on the front end. Some people are not going to make that decision. For a county facility, our intention is certainly to be there for at least that long. Plus, when you plug in the credits from the IRA, then that really shrinks. The percentage credit is upwards of 50% once you have all these other tags onto that initial 30%. So it also extends further into the structure. So it's not just the geothermal system itself, but it's the associated ductwork, some of the associated equipment. And we've contracted with an entity who's also helping us maximize, like, where are those lines in the sand so that you're going to fully maximize that option. The The underground loop, which is the one we're doing, vertical, those can last 50 years. So in terms of length of time and benefit to the facility, you're looking at, that's your goal, is getting a 50-year before you're having something you might need to address. The auxiliary equipment, there's less, I guess in a nutshell, a conventional approach would have more, more equipment distributing the air, hot or cold, throughout the facility. And that is a big swing in the HVAC costs as well. And so we've looked at, because we did look at what would a conventional approach look like, how much would it cost, what would the changes be in terms of design, in terms of pumps, VAVs, fans, all these different pieces to the puzzle. Trying to think if there's any other notes I have here. Am I getting at your?
Well, I guess I still want to know why solar isn't being considered in earnest, even going forward. It sounded like you weren't even going to put structures on the roof. I mean, I don't know, my energy costs are going up residentially. I'm a UPS or a WPS customer. I don't know what commercial rates are and if ours are similar, but they're going to the PSC next year for 2 more years of increases. You put a solar on there and it keeps our costs pretty stable. And we don't know what's coming in the future, especially if we continue to get data centers that are also even more energy hogs, and now we have to build new plants or keep plants open. I just feel like we have an opportunity in this planning stage to future-proof this building. Now's the time to do it while we're building it, not after to piecemeal it.
Yeah, I mean, there's arguments either way. I think you're right in terms of the rates are going to go up. I think you're right in that the bang for your buck, so to speak, with solar is limited by net metering. Now, net metering on that facility would help that facility. I think if you'd probably see more of a return, I guess, or you'd be able to get more savings through solar that would serve your much higher end users. But nevertheless, for this facility, I think in our discussions, we looked at it as making the choice. For the time being, there's a huge coal pile across the street, so that was considered like there's going to be maintenance with coal dust blowing over potentially. There'd be just additional costs to the project as well. So kind of, I mean, yes, there's more cost. There's an ROI for that as well, but we're also trying to fit within a framework that can make the funding strategy palatable and work, but then and not unnecessarily add to it. And so when we looked at which one is going to gain more efficiencies, which one is going to last longer, which one is going to, I mean, there's nothing to say you can't add solar even at a later date to tie it in, but the discussions we had focused on which one was the best direction to prioritize, and that's how we ended up where we were. It wasn't to say that solar couldn't work or doesn't work, but I think comparing the two, we moved in that direction.
To follow up on Supervisor Lemmer's call, did we cost out solar? How?
No, we looked at, once we added some efficiency gains in the envelope and avoided some of the roof penetrations, that was, conversations with the architect in terms of like what would be a good alternative to that approach. I think if we wanted to cost solar out now, we would say, okay, here's what the general footprint is at 90% design, and then you would try to figure out how many kilowatts of a panel you would need to net meter that. And I can ask, I'm having them put together a business case for geothermal because I'm sure there will be other people with questions about that.
Supervisor Lemmer.
Yeah, but this is a little unrelated, but, going back to your question or your statement that nothing's being built yet and we can stop at any time. it would be helpful to know when that break-even point is, or when we can't really stop. I feel like our sunk costs are getting up there, and maybe asking you to go back and add, to this is cost prohibitive. I don't know. But I remember you presenting a project management type calendar. That might be helpful to have in the packets just going forward, so we can see where we are in the process. When I came on in 2022, there was some criticism in the NCHC project because it was now, we can't stop now. We are in the middle of a build. It would just be nice to know, when is it we're not stopping.
Was that to me? I mean, my thoughts on, when do you stop? At the end of the day, it's always up to you. You're right that there's some costs in getting to this point, but that's also why we come back regularly to say, like, here's what we've done to this point. Now, if you want to continue, this is what it is, and there's costs of that. And again, this is the same sort of authorization to say, like, we're not going to put a bid package together. We're not going to advertise it. We're not going to do anything else for pre-construction if there's a desire to hit the pause button. And then if we say this passes at the board, then we come back again in October. Now, your sunk costs between now and October are not going to be as much. But at that point, you've got that fully fleshed out. Here's what it looks like. So in terms of, when are you really incurring the costs? I mean, most of your costs right now are wrapped up in real estate acquisition. I mean, there's some degree of design costs. The construction manager cost is super minimal. Even the designated funding, that, like, well, I guess that's a different tangent. But in terms of when you can stop, anytime we're bringing it back to you, you can, and even in October you can, and you can say, look, we're not going to do it, or we're not going, we're going to wait, or we're going to, and at that point I'd say, okay, well, we have all of this final data put together. So now the general industry assumption is that if you want to do it next year, it would be a 4% increase, and things like that. I think when you get, maybe when you're mid-project, like your reference to North Central, what you have is you're paying general conditions to people every month just to be on site working. You're paying for the power, you're paying for winter conditions if it's in the winter. You're paying for mobilization of all those contractors who are all on schedule. And so it's like, it's a ton of moving parts. So like once you really begin constructing, that's where the construction manager and our team is working to make sure that everything's falling into place when it needs to fall in, including like those long lead items. It's like we know precast concrete is 10 months out. So we got to think about when do we have to buy it so that in 10 months it's ready to go when it shows up. So when you try to stop there, then you're still incurring costs, but you're not moving. Right now, you're well beyond the conceptual phase, but you're right on the cusp of here's what the full package would look like from a design and cost perspective.
All right. Any follow-up? We'll move on to the approval of amendment to the 2026 budget for local road improvement program funding.
There's a memo in your packet on page 188. You need to amend the budget to capture the LRIP money.
Are there any questions?
This did go through the infrastructure committee last week and was approved.
Any discussions? And Supervisor Zhang has been with us for quite a while, so Kevin Lang is on if we have any questions relative to that. Chair Gibbs. Seconded by Supervisor, Vice Chair Poole. Any discussion? If not, all those in favor will signify by saying aye. Aye.
Aye.
Opposed, no. That motion carries. All right, we are at approving the 2027 capital improvement tentative project list, KIP, a high-level overview. would be appropriate at this time.
All right, I'll do a very high-level overview. So just to cut to the chase, this is not funding anything. This is just the proposed project list to say, we received a bunch of submissions from departments. We received numbers from Sam and Finance to say, here's what we have to work with. And then we put that against the priorities that the departments have put in. And then also in the big picture, trying to sort out like which ones are objectively lower or higher priority based on what's left after those considerations. Just for a little bit of context, you know, and I included this on this year's sheet, the currently available CIP funding is just shy of $5 million at $4,969,464. Now, to Administrator Leonard's point, last year, we scrounged up a lot of the money to make the projects work. But what stood out to me this year, too, was that those core things, the CCITC funding, the highway road project funding for GTAs, and the fleet and rolling stock funding are big chunks of the CIP as overall. Now, there's larger need in terms of, you know, the value presented on the 5-year plan, or costs, I should say. But as it is today for this plan, roughly 80% of the available funds are going to those 3 categories. So everything else is going to be interpreted through the remaining 20%. Let's see. The top portions are all info only. That's just for projects at those departments that are happening. They have their independent boards. Some of that comes through us, but it gives you a sense of what they're working on next year, and then looking ahead what's coming down the pike. At the very top, those numbers come in later in budget development for highways bituminous program and the culverts and bridge aid, as well as there's usually a small rollover from fund balance into the library reserves. But that's really an informational thing. There's no funding or approval associated with those projects from the board, other than the fact that they're on this list for your awareness. The next chunk, you'll see that in the column next to the column to the left of the highlighted column is the one that's the proposed list. The next one over are the submissions we got from departments. So you'll see that right away you're starting with not funding certain things. The county facility parking lot repair fund, that's just things that, absent those funds, we use other lines to fix serious issues, or we try to limit the damage or patch it, I guess, if you will, with what we can do. The annual restroom replacement is not in here. Then we get to CCITC. Again, they are facing a lot of inflationary pressure with the cost of their equipment. Rolling stock and vehicle fleet funding, I did apply the formula to increase the funds. That's that 4.132%. I've said this previously, but that includes in the 5-year look back at CPI an 8% in those numbers. That 8% is dropping off next year, so that 4.132 will go down absent that 8. So next year's rolling stock percentage increase will go down. We have been having discussions about the sheriff's office fleet. We had one yesterday at Public Safety. Highway, they certainly have similar issues, as well as parks. We've taken some steps in the last year or two to help in highways area. Parks, they've got their priority list, which they also had last year based on the funding that's available. So, and I'm just trying to be brief, Mr. Chair. Again, additional projects for IT. There's consistently pressure from outside the country and otherwise in terms of cybersecurity. So these are all important items to move forward. The county clerk has a project for election equipment updates and new tabulators. She's here if you have questions for that. But, you know, my wife also being a county clerk, I know that these equipment purchases can really update and revolutionize what the voters are going through when they go to their polling locations. So getting these things updated is very important for the county and municipalities. You'll notice that there's an accessible express vote machines a couple years down the line. That's only moved because the current equipment is sufficient for now. Like, there's no issues with it. But a couple years from now, we will have to focus on that equipment as well. The probation and parole, this is Department of Corrections in the basement. We've been working with them on a design and construction proposal to expand their square footage and give them more of a footprint in the building, which would help them regionally and locally and give them more capabilities to bring in a sort of an all-staff meeting. This is the first year of that. That 66,000 is the quote from an architect to provide these types of services to then the following year, you see the $840,000 to actually do the remodel construction downstairs. In facilities and capital management, our top two made the cut. For full transparency there, on some of these smaller items like courthouse exhaust replacements, if I have some funds at the end of the year, I might try to piecemeal, and I can't do all 17 at once, I'll do 5, maybe come up with an alternative strategy to try to help out with the overall CIP picture. But the majority of these projects here are not funded. Some of them have not been funded previously. I do speak with our staff every couple of weeks about CIP projects specifically this time of year, and the priorities that we see here are the latest iteration of those conversations. Some of them imply other work down the road, but a lot of the courthouse work is because the HVAC equipment in some of the areas is quite dated. So that's why you see a lot of that there. The highway road projects, these are the things that are must funds because you've got a 6-year window, 6-year tail on the funding calculations from the state. So we want to make sure that we're investing in our roads in a way that doesn't damage the transportation aid we get from them. You also notice that on the left, I've given the total cost of the project, which is showing you that our portion is significantly smaller than the overall cost, which is a big bonus for the county, especially this year. The one unique one here is that the county trunk highway HH culvert replacement, the initial approach to that is not going to work as it was designed. So Kevin and his staff took a harder look at what was actually needed there. And so that 2026 carryover is saying that we have $425,000 allocated to that project from this year's CIP. They need another $250,000 to make the overall new approach to that culvert replacement work. Parks, Recreation, and Forestry, this is the planning, architectural planning for the Junction Building in Marathon Park. This number reflects a range of costs for an entire scope of work from pre-design all the way through construction documents. So it's arguably, it's true that, you could get through pre-design and a concept at around, $10,000 to $15,000. The rest of that would also depend on how much of the building are you looking at. Is it triggering electrical, plumbing, HVAC, structural? Each of those are going to add to the cost. And so that the Parks Director did get a quote from a firm, and that number is just reflecting sort of the ceiling of all the different ranges that the firm gave back in their quote. The other projects there for parks, some of them have been previously listed, similarly not funded again this year. But again, when it comes to these things, none of these decisions are easy when it comes to priorities. It's just a matter of what can you let go a little bit longer, or what can you try to tackle some other way during the year. It's not to say that any of these are necessarily not important. It's just that in the grand scheme of context with what's on the sheet here, we have to make some calls in terms of what to move forward. That's similarly true with the Sheriff's Office, the detention facility, their envelope. Being proactive a few years ago, we looked at some issues that really we could get ahead on. We've been postponing that and not funding it. So long story short there, that things will deteriorate over time. And so the cost may go up occasionally, not necessarily with this, but occasionally with projects, you have vendors who go out of business. And so then it's harder to find people to do the work. The balance of the sheet are things that weren't really requested, but are still there on the plan, and you'll see in future years. At the very bottom, I included the current funding available and then the total cost of proposed projects. The red number there of $24,162 is the net difference between the two. Speaking with finance, I think that 1 or 2 strategies that you could look at to make that up between now and budget adoption, should this plan go forward as is, would be to use a sales tax adjustment or an interest revenue adjustment to just make those numbers whole and move it forward.
All right, are there any questions of Chris? Again, this is a preliminary KIP. The final KIP will be incorporated into the budget. Any questions, discussion? Vice Chair Poole.
I'll move to approve the 2027 Capital Improvement Program tentative project list.
Is there a second? A second by Supervisor Nysteth. Any discussion? If not, all those in favor will signify by saying aye. 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 Opposed, no. That motion carries. All right, we are going to delay the consideration of 6B5 until our next meeting. Supervisor Jensen, who requested that we delay it, was not available today, so we'll bring the. I'm sorry. I jumped over 4, but we are going to delay number 5. We'll go to number 4 until the next meetings, so. Administrator Leonard.
Sure, there again is a memo in your packet. This committee and the full board approved a fund balance policy last term. And as part of that, you set up in a number of departments what we termed non-lapsing contingent accounts. This issue was taken up by Public Safety yesterday. A lot of good discussion at that committee about kind of the strategies that might underlie the creation of those. Ultimately, the Public Safety Committee moved forward with the recommendation to create a non-lapsing contingent account in the medical examiner's office for $250,000. I think a lot of that conversation was around the dollar amount. It is candidly as large as the sheriff's office contingent account, non-lapsing contingent account when you add the sheriff's office and the jail together. So I'm sure you're gonna ask why, so I'll preempt that a little bit. So these accounts were set up for a department when they get to the end of the year and they have revenues above expense, rather than have in the general fund, those funds roll from the departmental budget straight back into the general fund, and then in the year following the audit, they be used to fund capital. What this does for those departments that have a non-lapsing contingent account is that any amount, revenue above expense, up to this ceiling of that non-lapsing contingent account would go into that account. The departments can't spend it, but it goes into that account, and then if there is a need that a department has, they can approach the county board. They approach me first, we talk about it, and if I approve of the request, it would move forward to the full board for consideration to tap into that account to fund that request. You just had one that you approved at the county board last month. The DA's office has a non-lapsing contingent account, and you approved a small office remodel there. I think I'll give you my 2 cents on why I think these accounts are good. I think it provides good incentive to departments to go through a bit of pain that they might otherwise try to avoid if they know that they will be able to fill up that non-lapsing contingent account, fill up that bucket, that when they really do have a need, they can go to the board and say, hey, I have this need, but great news, I also have some money to fulfill that need. I'll give you the best example for how departments get revenue over expense is holding positions open. That is the way they do that. If you hold positions open, you are likely to have less personnel expense than you would otherwise have. Again, we're a service-driven organization. A significant amount of our overall budget is staff. It's personnel and it's fringe. So the request for the medical examiner's office is $250,000. That is driven, why is it so high? It is driven because their business is really a business. They are highly revenue dependent. We talked before about the chief medical examiner office position. That is an expensive position. If we don't have enough autopsies, enough business coming in, that position still costs money. So our revenues can be highly volatile. At the same time, if you have a vacancy in that position, you might have the benefit of less expense on personnel, but all of the other personnel you have still exist and they're not bringing in the revenue to offset. So that's one reason. And then also, there's expensive equipment in that building. The county board approved that building is just shy of $15 million. We had a lot of outside funding for that. But if a piece of equipment, the full body x-ray machine, is about $300,000. The idea is if we're gonna operate as a business, let's take some of those revenues that are coming not only from Marathon County tax levy, but also from outside customers, other counties, hospitals, what have you, and let's build a little bit of cushion. That's the strategy, that's the thought. I get there are absolutely downsides to it. I know Chair Robinson and I had a good conversation about it. It does reduce what rolls over for capital. If departments behaved exactly the same, it would reduce what would roll over for capital. My sense is that departments will endure more pain when they know that they at least can show up and say, hey, I endured some pain. Here's the bucket. I have a thing I want, and here's the funding. But all that said, I know you're likely to have questions about or thoughts on, is $250,000 too much? One comment that was made at Public Safety earlier this week, which I think is very good, Chair Robinson suggested that we frequently take a look at those funding amounts, the caps for individual departments, to evaluate whether or not they're appropriate. And I think that's a really good idea. A lot of them are small. This one is larger. And in fact, it might make sense to have the sheriff's office, in light of some of our CIP needs, maybe we change theirs as well, increase it if we can use it to fund squads. They might endure pain there, but I digress. The request is to start to make the amendments to add the medical examiner's office to the list in the amount of $250,000. This would need to go to the full board.
Question, so when have they ever had expense that they needed $250,000 for?
It's a great question. It's important to note, we just transitioned from a lay office to a physician-led office. So historically, we used to take decedents to other counties to have autopsies. The new building we built out by North Central Technical College has all of the necessary equipment for us to do autopsies. Full-body x-ray machines, very expensive HVAC equipment to make sure that we have a negative pressure set up. We have a cooler and a freezer. We have a lot more stuff now because we just transitioned. The building is essentially brand new. So short answer, we haven't had anything, knock on wood, break that would require additional $250,000. We have historically had to dip into alternative funding for things that the medical examiner's office needed. Most recently, and notably in my mind, we bought a cooler a number of years ago that was about right around $50,000, and I can't remember the exact funding we had, but that was not within Jess's budget. We don't have $50,000. We didn't have $50,000 in their budget to buy stuff. We don't have $250,000 for equipment if it breaks.
I do like the idea of this non-lapsing contingency account, but yeah, I kind of struggle with the price. You know, that seems excessive, but in my personal opinion. But then again,
yeah,
I've never seen what their expenditures are over any kind of period.
Yep, and this last year, they didn't have any revenue above expense, right? Yeah, we didn't have any. So again, the $250,000 is the cap. If you want to drop the cap, you certainly can. It was our best guess in light of the business needs, the nature of the business in the department.
Chair Gibbs.
Thank you, Mr. Chairman. I look at this department a little bit differently. In the fact that we have a business plan, or the department has a business plan, and we looked and we set this up with the idea and the ability to contract with other counties to be able to provide these services. When I think about this lapsing account, non-lapsing account, obviously, the administrator pointed out, it tries to incentivize the right idea for the department to potentially endure pain. But I look at it as, if the business plan to fund replacements is coming from the services that we're billing for these other counties, it alleviates the potential need for the county to have to come up with additional tax levy to cover replacement equipment. So I look at it as we're funding depreciation with the business operation over a long period of time. we're not going to get to 250,000 in 1 year. There's no way that we're going to have $250,000 of excess revenue in that department in 1 year. So what, you know, if the business plan holds true, we're going to potentially, as we continue to add additional counties and additional services, potentially generate additional revenue. We can then set those aside in that non-lapsing account to provide for the ability to replace that equipment as that equipment needs, alleviating the need for tax levy to pay for that equipment. So I'm in support of this, but I do also understand that there's, you know, the trade-off is that the rollover that's going into this isn't coming back to the county for other uses. But at the same token, I look at it at the other contracts are paying for this if we're not increasing tax levy to support the operation.
I would view this too as, in essence, we've moved this into a quasi-enterprise fund, similar to the landfill and in others where there are revenue sources. It continues to look at tax levy support, but in our effort to contract with others, we're sort of moving it into the enterprise. The advantage of having the non-lapsing contingency fund is that we do have a hiccup. We're not using county levy dollars to supplant that. We're rather relying upon reserves that we've built up through the profitability, either increases in revenues and or decreases in expenses over time. But I do think that it should be, as with all of these funds, reviewed by this committee and the county board on a regular basis to make sure that it's meeting the intended purpose, it's serving the purpose of driving down expenses and encouraging frugality at the end of the year. But I think that's on this committee to do so, and I would strongly encourage us to do so, and I'll try to put it on the agenda in the future, but I think there's merit in adopting that non-lapsing contingency fund, given the uniqueness of the department.
One other thing just occurred to me, and I got up and asked Jess, to the chair's points that he made at public safety and that I referenced today. I asked Jess, historically, pre-transition to a physician-led office, what her recollection of their budget, how much at the end of the year did they have frequently revenue above expense to roll over into CIP? Because my recollection was they're a tight budget, and she confirmed that. So I don't know for sure. Certainly we should watch out, but I don't anticipate this department would have been a large source of rollover for capital anyway. I don't know if that's of substance or not.
Any other questions? If not, what are your wishes?
This was already approved at public safety, but it is here as well.
Chair Gibbs.
Make a motion to approve the amending of the fund balance policy to create a non-lapsing contingency fund for the medical examiner's office with a review annually on the appropriateness, and move to the full board for consideration.
Is there a second? Seconded by Supervisor Nyseth. Any discussion? If not, all those in favor of that motion will signify by saying aye.
Aye.
Opposed, no. That motion carries. Any items that you would like to see us talk about at the next couple meetings?
We're not gonna look at number 5, 6B5?
Just to let everyone know, you have a joint airport board meeting on the 14th at 5 p.m. So just make sure on your calendar. I think it's at the airport. It's at the airport.
September 14th? All right, we kick item 5 to the next meeting, so Supervisor Jensen can be here. Out of order.
Thank you.
So with that, our next meeting is August 25th. Item 8 is before us. Vice Chair Poole moves to adjourn, seconded by Supervisor Zhang. Oh, by Chair Gibbs. All those in favor, signify by saying aye.
Aye.
Opposed, no. That motion carries. I thought I'd ought to get into the, did he just leave? I gotta talk with him about being here.
No, that was, man, that was ripping in. You were kind-hearted.
I'm hoping